Okay. Hello everyone. I'm Dr. Sunaina. I'm back. Good morning and happy Father's Day. Happy Father's Day to all you fathers out there, all you single dads also, exchange fathers, fathers to be. So I'm Dr. Sunaina Hameed and I'm back because for the last several years now, 2 times in a year I come online and I join the Sebamed India family and all you Sebamed India fans. And we have discussed all and replied all your queries and questions related to various skin and hair related issues. I think we have spoken over the years on acne, on rosacea, on pigmentation, on hair related issues. Let's see. There's someone in there. Hello. Okay. And just take that out. Okay, I hope I'm audible to everyone. And I think we've spoken about moisturizers over the years. We've spoken about sunscreens. I think last year we even did a podcast on how skincare and healthcare industry has changed over the pandemic. So for those of you who are not familiar with me, I'm Dr. Sunaina Hameed. I'm a Bangalore-based consultant dermatologist. I completed my MD in dermatology from Kasturba Medical College, Manipal in 2008. And since then, I worked in private practice. I worked in a bunch of private hospitals and corporate hospitals. And then I went on to get my diplomate from the American Board of Laser Surgery in 2014. And since then, I have started my own private practice in Bangalore. It's called Skin Health Advanced Dermatology Center. It's a state-of-the-art, world-class skin center. It caters to almost all skin and hair related clinical concerns and aesthetic concerns. To know more about us and the services we provide, you can visit our website www.drsunaina.com. And today we are going to speak on anti-aging. So why anti-aging now? We're talking about anti-aging because actually this is related to various concerns and queries I get almost on a daily basis, mostly from women, some from men as well. But I have realized over the years that from men, the queries usually with anti-aging are hair related, especially if men start losing hair from their 20s or 30s itself. That starts leading to a lot of depression and it really takes a toll on their self-esteem. But generally the trend is that societal pressure and peer pressure to look young for long periods of time, forever, this is usually more on women than it is on men. And when it comes to anti-aging, there are two categories of women that I have seen over the years. So one is the category of women who have reached some major milestone. Usually it is when they've just hit their 40th birthday and then they come in and they meet a dermatologist now for the first time in their life, and it's almost as if they have felt that now that I've hit 40, now I'm going to start aging. And they say, the doctor, I just turned 40, I think I need to start doing something to take care of my skin. And usually these women, when I ask them that, okay, what is your skincare right now? So usually they say that, I just use some generic toilet soap to wash my face, or now I think I've started recently using a face wash to wash my face. And they will say that I use a sunscreen, not every day. I don't go out much in the sun. When there's a vacation or some holiday, when I'm out in the sun, I will use a sunscreen. And they will say that I use moisturizer, usually some aloe vera or something, if the weather is dry or if I feel the need for it. So this is very rudimentary skincare. They only feel the need to take care of the skin once they turn older, or once somebody has made a pointed comment that maybe you need to take care of their skin. And the other category of women I'm seeing now in the last few years are women who are still young, women in their 20s, early 30s, and they are very hip, they are very in the know. They are following every beauty blogger who's out there. They've read all the articles, they know all the keywords. They've heard of retinol and niacinamide and arbutin and vitamin C and bakuchiol. They've read everything and they have information overload and they don't know what to do with it. and they come with a whole bag of products that they bought from all over the place based on anything that they have been told by the beauty shop people, that you need this also, you need that also. And some of them have this whole, on the phones, a whole notepad that this is what I use. And some of them have come with whole papers and charts to me that I have 3 different types of face washes, I have 2 different types of makeup cleansers, I have one for the eye, one for the eyelash, one for the face, one for the lips. I have 3 serums. These are the serums I use Monday, Wednesday, Friday night. These are the serums I use Tuesday, Thursday, Saturday night. I have a serum for the morning. I have serum that I use add in 2 days in a weekend. And I have 2 different types of sunscreen, one for the outdoors, one for the indoors. One is mineral, one is chemical, and they're completely confused. And when I see their skin, they don't have any major issues per se, but the skin is really oily and clogged from overuse of products. And some of these women come saying that, I had really fairly good skin, and now I have got a lot of rashes, and I've got a lot of redness and peeling of my skin, over exfoliation of my skin, and this is most likely because I've ended up using too many skincare. So this is another category of people who have a lot of information but from the wrong sources, and they never met an expert to really guide them on what is the skincare that they need, that is customized skincare for their skin type. So this is why I felt that we need to do a program on aging. First of all, when do people start aging? Do you suddenly overnight go old when you turn 40? Actually, that's not true. Aging is a dynamic process, and we all actually start aging from our mid-20s, because up until that point everything is in a growth and development kind of a phase, and from mid-20s then it starts going into a maturation and a breakdown kind of a phase. It's just that from that point, from your mid-20s, the visible signs of aging are still not evident. So they only become evident around the mid-30s or so, which means that if you start taking care of your skin from your 20s itself, you will reap the benefits of it when you're in your 3rd decade, when the signs of aging will not be so visible. So now starting from the 2nd decade in that case, and again now coming to aging, please understand that anti-aging is not just about using the right skincare. Aging is much more complex than that. Aging comes to many factors like ethnicity. For instance, if you're a white skin person, and when I say white skin person, I'm talking about Caucasians. Their main problem with aging is lines and wrinkles. For instance, Indians, and when I say Indians, all Indians, including fair skin Indians, we are all brown skin, we are not white skin. We don't wrinkle very badly. Wrinkles and all come a little more later in our late 40s, 50s and all that. For us, pigmentation is a problem. And in Indian skin, aging shows mostly in the form of pigmentation. So ethnicity plays a role, but even in Indians, if you were born in the hills, you will start wrinkling faster compared to people who are from the plains. The second factor is genetics, of course. If your parents usually had good skin, did not age, into their well into their 40s, 50s, genetics plays a role. If you were genetically blessed, nothing like it. The third thing is lifestyle itself. If you're a sun lover, you're an athlete, you're in a job like real estate or construction, or you're always out and about in the sun, you will show signs of aging faster. Stress plays a role. If you have had a life where you have been chronically stressed, you will age before time. Your skin will show signs of aging, your hair will show signs of aging, your body will show signs of aging. Versus somebody who has had a very protective, comfortable life, no financial problems, no health problems, no mental health issues. Other thing is lifestyle choices. If you drink a lot, if you're a smoker, chain smoker, obviously you will age before time. The next is also, general rest and exercise. If you've never had enough mental rest, if you are chronically sleep deprived, if you have worked months, years, long periods of time in a night shift job, then in those kind of cases also, you will age before time. So inadequate rest, enough exercise, keeping your weight in control, eating on time, sleeping on time, eating healthy, these all will, show the benefits in the long run. If you eat wrong, if you're overweight, if your hormones are out of control, all of these things will make you age before time. So these are equally important. Please bear in mind, just with skincare, that is not the only part of anti-aging. So the second point to keep in mind is, okay, I'm starting to see some queries. Please keep in mind that the topic for the day is anti-aging, and also I am making note of your queries, and if you keep listening in to my talk, most of your queries you will find answers to it as you listen in, and anything that's not been covered I will cover in at the end of the podcast. Now so that was part of it. And the second thing, before we start going through anti-aging through the decades, I'd like to stress the importance of sunscreen. Fortunately, in the last few years, I'm hearing more and more patients already before they come into us, they are already using a sunscreen. I think thanks to a lot of talk and education that is put in there through dermatologists again and again, stressing the message of the importance of a good sunscreen that cannot be stressed. Most people underestimate the amount of sun they're getting in the long run. If you start using a sunscreen in your 20s, a sunscreen is not only one of the cheapest but also the most effective anti-aging that is out there. So the majority of the aging changes that you see in your skin is because of sun damage. So all the people who are asking about pigmentation solution, please get a good sunscreen. A pharmaceutical sunscreen will any day give more benefit than any cosmetic over-the-counter sunscreen. Please bear in mind that the SPF only covers for the UVB radiation. The good sunscreens these days also have antioxidants in it that will cover also for UVA radiation. That it comes down to the PA+++ filter that you see in it. It comes down to the Boot Star rating. So please look for these ratings in your sunscreen. No part of anti-aging skincare or anti-pigmentation skincare is complete without a good sunscreen. Sunscreens with added antioxidants will also protect you from blue light or infrared radiation. So that will give you the complete spectrum of skin protection. So now from here, from understanding when we start aging to understanding that aging is not just about skincare, you have to take care of other factors as well, and to understanding that nothing can work without using a right sunscreen. If you're having a mental block against using a sunscreen, or you think that it is a worthless investment, then nothing is going to work for you. Secondly, now starting from your 20s, how do you take care of your skin in your 20s? The very basics, and this is even for a person with perfectly good skin, is to use a good cleanser, a good moisturizer, and a good sunscreen. These three basics have to be covered. Secondly, there is no one size fit all. So there's no one face wash that will work for everybody. There's no one sunscreen or moisturizer that works for everyone. Secondly, it depends on your skin type, whether you have oily skin, dry skin, or normal skin, whether you have acne prone skin, whether you have skin with a lot of pores, whether you have skin with a lot of comedones. So second thing, a lot of people ask for toners. Now, I don't think dermatologists are really recommending or prescribing toners anymore. It's a little bit of an overkill. Second thing is, I don't know of too many dermatologists who have toners in their own pharmacies. So it doesn't do all that much. It just zips and tingles your skin, and if you have a good cleanser, that's more than enough. So double cleansing is also a good idea, especially if you need to use makeup on a daily basis because of a job or for whatever reason, where you use a good makeup remover or micellar water or even oil cleansing to clean out makeup, and then use a face wash. A makeup remover is not a face wash, and a face wash is not a makeup remover. Second thing people ask me that, starting from the 20s is, what about exfoliator or scrub? Do I need to scrub? How often do I need to scrub? And what scrub do you need to use? So exfoliation or scrubs is something that, up until recently, even dermatologists used to talk about it, that yes, scrubbing is good. Don't overdo it, of course. Don't do it every day. Once or twice in a week is more than enough. And up until a few years ago, there were even these, even dermatologists used to recommend and sell them in pharmacies, these home kits. They used to have this cream-based scrubs, and they would have a cleanser. They would have, a handheld brush, a machine brush to, rotate the scrub onto your face. Now the concept is changing a little bit. We've moved from the era of physical scrubs to chemical exfoliation. Secondly, we don't think that everybody needs to exfoliate. If you already have dry and damaged skin, if you have severe acne, sometimes exfoliation does more damage than good. Chemical exfoliation, this you can start from your 20s itself. That is usually alpha hydroxy acids like glycolic acid, lactic acid, and mandelic acid. They come in toners, they come in serums and creams and face washes. Or, as beta hydroxy acids, very good if you have open pores and comedones and acne. Or polyhydroxy acids, lighter and milder on the skin, though a little slow acting. So this is something you can start using it 2 or 3 times in a week to begin with, and after a couple of months, once your skin is adjusted to the exfoliation, you can even start using it every day, especially if you live down south where there's no such thing as a winter per se. So in your 20s, basically skincare comes down to cleanser, moisturizer, and a sunscreen. Toner, not so important. Exfoliation you can do, but choose chemical exfoliation. And this is something, again, broadly to an audience, I cannot tell you this is what you need. You will eventually need to meet a dermatologist to figure out what suits you. There is something called customized skincare, where each person has skincare that is suitable for their skin type, for their specific skin goals, for their skin issues, and according to their lifestyle. Secondly, do not buy into the myth that if you have oily skin or acne, you don't need a moisturizer. Wrong, very, very wrong idea. Everybody needs moisturizing, starting from when you're a baby till when you're in old age. It's just that you need the right kind of a moisturizer. If you have oily skin, you need a water-based moisturizer, or you need oil control moisturizers. The thing with oily skin is sometimes people tend to wash it again and again, 5 or 6 times a day, and every single time what they say is, when I wash my face, it gets really dry and feels tight, almost like uncomfortably tight, but then half an hour later it's really oily again. I don't know what to do about it. The thing is, when you keep washing your face like that, you're stripping it off completely of all the natural oils, and your oil glands get confused and start going into overdrive. They produce more and more oil to compensate for that dryness. When you start using a moisturizer, you hydrate your skin, and your oil glands will actually calm down, and they don't feel the need to shoot out that much of sebum, the bad skin oil, which is not even a healthy kind of an oil. So everybody needs moisturizing. So that's about skincare in your 20s. The one important thing to take care in your 20s is if you have acne. If you have pimples, please take care of it, because if you don't take care of it now, eventually your acne is going to lead to a lot of bad open pores, pits and craters, which is going to make your skin look old before time. People who have suffered from bad acne, their skin ends up looking very aged before time. Secondly, most people who have acne, they always think that if I go to the doctor will give me some face wash cream, I'll use it once, my pimples will go, and it will never come back again. And then when they do come back, they think that this doctor didn't know their job, I'll go to another doctor, maybe the next doctor can help me. Please keep in mind that is not how acne behaves. Acne is a chronic condition. Acne is not an acute condition. Whatever your doctor does, acne is something that will come and go, probably for 10 years, a decade, before you finally outgrow that age. So acne care will continue for a long period of time. Acne treatment goes on for a long period of time. You will be meeting your dermatologist periodically, but if you take care of it now, you can protect your skin from the long-term damage. So part of your anti-aging on the long-term goal is that if you had acne in your 20s, you should take care of it, and take care of it consistently and correctly to make sure that your skin doesn't look older when you are in your 30s and 40s. Now then, coming to your 30s now. Now, I know that a lot of people will say that, 20s is the best age for the skin and then it never comes back. I sort of disagree. I feel that if you took good care of your skin in 20s, I personally feel that the 30s is the best decade for the skin, because your skin has matured now, but in a nice way. All the contours and everything of your face has matured nicely. Your skin is not so skinny as before. Your teeth don't stick out like before. So 30s is a good decade, I feel, but you will need a little more now in your skincare. This is a time when you need to really focus on nutrition internally and nutrition for your skin. So this is a time when you have to add antioxidants. So antioxidants both internally as well as antioxidants for your skin. So for your skin, the most popular antioxidants would be vitamin C. Now almost lately every single person that I've met at the clinic, they're either already using a vitamin C or they're asking me, tell me best vitamin C for my skin. And there are a lot of vitamin C is out there. Every other person, even salon people who don't even understand skin, they are also formulating their own vitamin C. Basically they just go to these pharmaceutical companies somewhere in Uttarakhand and all that. They just tell them that take any generic vitamin C, put it in a bottle, put it our label, and we will start marketing it aggressively on Instagram. And this is how vitamin C is come in the market. They believe that we will just get the cheapest quality vitamin C. If it is less expensive, there's so much of hype about vitamin C that people will buy it. They're just looking for the least expensive vitamin C which is out there. First of all, with these things, vitamin C formulation matters. There are different formulations, but L-ascorbic acid is the most potent, most biologically stable and effective vitamin C formulation. Concentration matters. Start with vitamin C 8% and you can move up to 15 to 20%. You'll even find 30% vitamin C if your skin can tolerate it. But once you go higher in percentages, some people get irritation with it, and the effectiveness kind of tapers off after 20%. Third thing, packaging matters. Vitamin C is highly unstable. That is why dermatologists will only put their name behind pharmaceutical or research products. Because vitamin C, if you go through it within a week, 10 days, if your vitamin C it starts breaking down and if it starts oxidizing, what is the use? You buy a bottle of cheap vitamin C even for 500 rupees, and after opening the bottle within 10 days, if it is oxidized, the rest of it is useless. So stability and how they formulate it is important, how they package it is important. It should be in airtight bottles. You have to store it properly. That's why vitamin C always comes in bottles that are dark blue, dark brown in color, or airtight pumps. And combinations matter. If you have fairly okay skin, good skin only, if you're just looking for preventative, plain vitamin C is fine. If you're looking for pigment control, the best combination is vitamin C with alpha-betaine, or vitamin C, E and ferulic acid combinations. And if you have older skin and you're looking for vitamin C as anti-aging and for hydration, then vitamin C with hyaluronic acid, those combinations are very good. So vitamin C, like antioxidants, this is when you should start adding it to your skincare. You have to start now adding antioxidants or some kind of oral supplements for beauty. These are also known as edible cosmetics or nutraceuticals. So it could be a vitamin C, it could be a vitamin E, it could be omega-3 fatty acids. If you're someone who is out in the sun a lot, you could also take beta carotene. Beta carotene acts as an internal sunscreen. Ibinone is another thing. Lately, what I've heard a lot of people asking me about is collagen. I mean, there was a time when I was getting queries, 3-4 queries every week. People mailing me and asking me, ASAP, tell me best collagen for my skin and all that. First of all, collagen, there are different formulations. If you're an athlete, collagen is basically, it was meant for athletes. Bovine collagen to recover quickly from muscle wear and tear and injuries and everything, and that's where collagen works best. Collagen for beauty, for skin and for hair, if it is to work, marine collagen, especially when you combine it with vitamin C, hyaluronic acid or glutathione, that combination is a sensible combination. But you have to take it in, for a sustained period of time, for at least 3 to 6 months to start seeing the benefit of it. And collagen, the genuine collagens are expensive. It's difficult for a dermatologist to put their name behind it for someone who really can't afford that kind of a product, because, for the amount of money you invest in, you may see that I don't even know if I'm seeing a change with it. On the other hand, what you could also think of these days, what dermatologists are putting their name behind, is rather than collagen to, take choline. There's something called choline orthoxylic acid. It comes in the form of tablet or a liquid that you can take it orally. And the thing with collagen is it's a protein, and when you take it in internally as a powder, most of it just gets digested like any other protein. Whereas when you take choline, it's not collagen, but it will stimulate your fibroblasts in your skin to produce fresh collagen on their own. It will also, it neutralizes homocysteine and it regulates cortisol in your system. These are the natural anti-collagens of our body. So this is again the sensible option, rather than just taking collagen powders or any low grade collagen powder and you don't know what you're taking in. It's probably you're taking in more sugar than anything. Speaking of sugar, cutting down on sugar from this decade will really benefit you in the long run. Sugar itself will lead to faster aging of the skin and hair. 30s is also the decade where you see little moles and freckles coming. If it's freckles, you need a Q-switch laser is the only thing that can help in clearing it up. If they're little DPNs, which usually come in women as they gain weight or as they develop a thyroid problem or during pregnancy, they're harmless, but they can very easily be removed, in a single session of a laser, not even very expensive to get these DPNs removed. Makes a big difference to your skin. This is also an age where most women may need, towards their late 30s, a little preventative Botox. The lines start coming in, especially when you smile, you get these crow's feet here, you start getting lines in these areas. Most of the time when women come to us saying that I think I need Botox, now these lines have become permanent creases, and then the Botox is not very effective at this stage. If you start doing it when these lines are still only appearing when you move your facial muscles, this is when you can prevent these lines from turning into permanent creases on your skin. But however, most of the time when we tell women in their 30s that you should think of Botox or skin tightening laser, they're like, no, I'm too young for all of this. Skin tightening lasers also, they only work when for women in their 30s and 40s. We get women coming in their 60s and 70s with a lot of loose skin. At this point, a skin tightening laser won't work. So someone has asked about Q10. So coenzyme Q10 is an excellent anti-aging topical in a cream form, especially for women in their 30s. At this age, it works very well. It is more of a skin firming ingredient rather than for lines and wrinkles. So this is 30s is the decade when we would add idebenone and coenzyme Q10 into the skincare. So that's about your 30s. We've covered about how you can add antioxidants, how you may have DPNs and you may want to get it addressed, and we've spoken about antioxidants in skincare and about supplements. And you may need to start thinking seriously, if you can afford it, to think about preventative skin tightening lasers for these lines that develop here, for the little sagging that develops here, Botox and fillers for especially for the upper face, so that you don't develop deeper lines in your late 40s. Now moving on to, is coenzyme Q10 vegan? Q10 is yes, it is vegan. There's none of the Q10s usually come with a red dot in it. Some of the supplements can come with a red dot, but usually that's because of the gelatin capsule which is there. If you're looking for omega-3 fatty acids which is completely vegan, usually these are from fish oil extracts, but there are flax seeds as well, plain flaxseed containing omega-3 fatty acids, and you can consider that. And where exactly the gelatin, if it's from beef or from pork, I don't think even we know that very well. Generally, those who are looking for vegan, we just give them vegan because we don't know the gelatin where it is sourced from. All right. Now, moving on to the fourth decade. Now, in the fourth decade of your life, I think this is the point where most men and women clearly start agreeing that signs of aging is starting. Now, this is a time where you will start seeing more moles, more pigmentation starting to develop clearly. I mean, it is very difficult to find anybody over the age of 35, 40 who doesn't have at least some form of pigmentation on their face. So, and like I said, for Indian skin, mostly aging starts in the form of pigmentation itself. So, is in Sebamed, which has Q10, is it vegan? Yes, Sebamed Q10 is vegan. Side effects of gelatin, there is no side effects of gelatin per se. The only thing is people generally ask if it is a vegan source. And gelatin, for some people, it may cause a little stomach bloating or cramping when they take it, especially in the first few days when they start taking gelatin in a capsule form. But as they continue taking it, usually the stomach adjusts to it. So yes, so as I was talking, now talking about the 40s. 40s, many people start seeing skin tags as well. A little skin tags on the neck and the underarm. Again, completely harmless. More likely to develop it if they run in your family. If you start gaining weight, they can be very easily removed with lasers. Some people start seeing rosacea. I mean, into your 20s, if you suffered from acne, 40s is the decade for rosacea, especially if you're very fair-skinned. A lot of redness and flushing and broken blood vessels showing up, usually in this butterfly area of your face. Rosacea, you have to stay away from the rosacea triggers. There is skincare for it. And for those who have these permanent broken blood vessels and redness, there are laser treatments as well. We do IPL photofacial. It works very well for pigmentation as well as for rosacea. And what else? This is also an age bracket where women start getting unwanted hair, usually on this chin and this neck and jawline area. So in the 20s, when women come to us for laser hair removal, most of them come for unwanted hair in the arms and legs and underarm area. And women in the 20s, when they have unwanted hair, most of the time there's some hormone imbalance there. But when women who come with facial hair developing on the face for the first time in their 40s, it isn't always because of some hormone disorder per se. It is just that age catching up. Your ovaries are shrinking, they're not producing enough estrogen like before. But your adrenal glands above the kidneys, they were always producing testosterone. They're still doing that, but the balance is a little off now. So because of that, you start seeing, dark hair coming in the chin, which was never there before. This can also be easily addressed with laser hair removal as a long-term solution. Instead of just constantly picking and plucking it, all this repeated plucking, it is just going to make the skin in this area very thick and rough, and there's a 5 o'clock shadow that starts developing there. And you start getting ingrown hair. It is just a sensible option to come for laser hair removal. There's a query on under eye dark circles. Yes, dark circles to a large extent is hereditary, and people do develop it sometimes in the late teens itself, but they become more and more evident as you grow older, because along with the darkness of the skin also, the skull itself starts shrinking a little bit. So sunkenness starts developing as well. Under eye dark circles is actually one of the most difficult things to treat. I mean, whatever we do, there's no under eye dark circle cream that really gets rid of under eye dark circles. They only improve the appearance. You may need many other things like a chemical peel, or if there's sunkenness under the eyes, filler is the only thing that will make it look better. A little bit of camouflage makeup always, because there's some flaws in the skin like open pores, freckles, under eye dark circles. These are difficult to completely eliminate. The idea of treatment is to improve the appearance. We cannot reach perfection ever, and this is where makeup helps in giving that near flawless appearance that we cannot completely achieve with skincare alone. So under eye dark circles, usually the ingredients we give for those people who have constant blocked nose, or under eye dark circles in people with sinus or asthma issues, we give vitamin K as an ingredient. There's kojic acid, there's vitamin C containing creams, there's caffeine containing creams, and as you grow older, they're usually retinol and hyaluronic acid containing creams, so that because along with under eye dark circles, wrinkles also start coming in this area. So yes, from your 30s itself, it's a good idea that along with skincare, you start using something for around the eyes also, because usually it's the eyes that give away your age generally, because this is very thin skin. So lines and wrinkles develop very quickly in this area, and usually most people, you can tell their age by looking at this area. And 40s is also an age where women, I think this is something that they don't usually pay attention to, but this is when their scalp also starts giving away their age. So if your hair starts getting thinning, and women only come to doctor when they see evident hair fall, when they see hair all over the floor, or when they see hair on the pillow, a lot of hair coming out in the wash, then they come running to the doctor. But they may miss signs of subtle hair thinning, where there's no hair falling out per se, but when they see old pictures, they can see, my hair has become thin in this area. This area, the central partition is looking wider, this area is getting thinner. Especially if you have had hormonal issues like polycystic ovaries, or a thyroid problem that is associated with female balding, or if balding runs in your family, men in your family who are bald, or women who hair becomes very thin after menopause, or if you're on certain medications like blood pressure medications and all, which are known to thin out the hair, you'll have to start paying attention to your hair as well from your 40s, which basically means the way you use anti-aging creams for your skin, you will have to start using either a redensil or a minoxidil to your scalp on a regular basis, almost on a lifetime basis now, to prevent your hair from getting thinner and to maintain the density or your volume of your hair. This is definitely an age where, for those who can afford it, you will need to do skin tightening lasers periodically, depending on the type of laser that your doctor has. Some people need to do it every 6 months, some people need to do it once in a year. You will need preventative Botox and fillers. With anti-aging, there's no such thing that you do it once. You cannot compare anti-aging treatments to a root canal or to getting braces or dentures, that you do it once and it's a one-time investment. You have to think of it as exercise. With exercise, just when you reach your target weight, you will not stop exercising. You have to keep at it. Similarly with hair color. With hair color, would you go back, you start doing it, root touch-up every 2 months, then you get to a point where you're doing it, every 3 weeks. So similarly with Botox and fillers, Botox lasts from 3 to 6 months. At least twice a year you will be getting it done. Fillers, you'll be doing it once a year, once in 2 years, depending on the area where you're getting the fillers done. So it all depends on how much you want to do. But anti-aging treatments, it is a sustained effort and it goes on for a while. There's no such thing that when can I stop. And there's one query on laser: does it have any long-term side effects? Well, if it is done by a qualified dermatologist with a good quality FDA approved laser, and your dermatologist itself is well trained in the use of lasers, and if the dermatologist is doing the treatment themselves and not giving it away to some technician or non-medical personnel to do the treatment, there's really nothing that can go wrong with laser. Neither is the radiation a problem, because I have been exposed to laser radiation since 2007. I was doing laser treatments for patients even when I was carrying my child. So of course we don't do lasers on pregnant patients, but if the laser is being done in the right place with the right person, then it is a safe device. In the wrong hands, then these are class 4 machines. They can be very dangerous if you're getting it done in the wrong place with the wrong hands. So that's more or less skincare in your 40s. In your 40s, you start seeing more and more flaws, and now it is going beyond just creams. There's not much just a cream can do. And women in their late 40s who come and say that I want skincare, my skin here is sagging, but for sagging skin also they just want an anti-aging cream. That's very silly. An anti-aging cream is not going to lift anything. I have permanent creases here, lines and wrinkles. For this also I want an under eye cream. An under eye cream is not going to get rid of these wrinkles. So for then you need to start doing procedural intervention. All right. So for pigmentation as well, anti-aging regime in the 30s. Someone has asked. We have just crossed this, but a recording of this will be available at the end. We will post it, and you can go through this again. And we have just completed your queries on anti-aging for the 30s. We've actually moved on to anti-aging for the 40s. Now going back to, so this is for 40s, and then what about then when you progress beyond your 40s, when you go into your 50s and 60s, and this is the menopausal years, and again, menopause doesn't happen overnight. Menopause is something that happens gradually. It's the process probably starts, or perimenopausal years start in the mid 40s itself, and it generally completes for women by about 55. There is something called as andropause, or what men go through, and that's again less evident for men, but they go through the changes as well. Changes in their body, changes in their skin, changes in their mood as well. So someone was asking about, what about men who are constantly exposed to the sun and have a field job? Yes, true. I mean, if you have a job or hobbies that keep you out in the sun a long time, you will age before time. So which means you have to take a little more care. The right kind of a sunscreen. You can't use a Lotus Garnier, some Jingbang, things like that. You have to meet a dermatologist. You have to use a high SPF broad spectrum sunscreen, a sunscreen with added antioxidants. So it says that it gives protection against infrared and blue light as well. Something with a boot star rating of 3+ or something like that. And you have to reapply sunscreen. The problem with sunscreen use is, first of all, a sunscreen will not 100% prevent you from tanning. So you will tan, but you tan a little less when you're using a sunscreen. Second thing is, you need to use the right sunscreen. You need to use it liberally. Using just a little bit doesn't protect. So the rule is a 60 grams or a 60 ml tube of sunscreen for the face and neck. If you're applied, if you're using it correctly, you will finish it in 2 months' time. And if a 60 grams or a 60 ml tube of sunscreen, if it is lasting you 1 year, that means you have not used it properly at all. And that's why it has not protected you. And if you're out in the sun for long hours, you need to reapply. Generally, we say 9 o'clock, 1 o'clock, 4 o'clock, and that is where, the problem begins, because people say it is not always possible. In that case, in summers, the 3 months of summers when the sun is really blazing, you can take beta carotene capsules. Again, your dermatologist, in a podcast like this, we're not allowed to take brand names, but you can speak to a dermatologist and they can put you in beta carotene capsules. They act as internal sunscreens. Everyone, when you're out in the sun, please use shades. Please use a good Ray-Ban or Polaroid sunglasses, because like I said before, your eyes will give away your age quickly. So you can use a sunscreen, but even with a sunscreen, when you go out in the sun and the sun is hitting your eyes, you will squint. You can't help that. And then those lines and wrinkles will start coming. So using sunglasses is a good idea. When you're out again in the field work and all that, along with sunglasses, using a wide brimmed hat, give yourself some protection that way. Try to find places where if you can spend some time in the shade. So you need to do a bunch of things to protect yourself. Cover yourself as much as you can, because using sunscreen on your arms and reapplying, if it's not practical, then wearing full sleeve garments, and that will protect you as well. So the 50s, as I was saying, the 50s are the menopause years. These are what I would call the rapid decline years. So what happens with menopause is, and women say this consistently, that, I had really good skin well into my 40s. Even when I was 40, 42, everyone used to say, oh, you look 10 years younger than your age. What do you do? And I don't know what happened after 52. It's like within the last 2-3 years, I have suddenly aged very quickly, very badly. I'm still careful about my diet. I still don't go out much in the sun. I'm still careful about exercise. I'm still otherwise healthy. I don't have any chronic illnesses. What happened all of a sudden? This is where hormones play a role. Hormones are so powerful, and I think we don't always give it enough credit. So, and this is something we cannot control. This is where aging is inevitable. Even dermatologists, we will also grow old, even though it's just that we take care of our skin and we have all the knowledge, we have all the tools with us, so probably it won't show as much, but it is inevitable. So there is a lot of queries. People ask about, what about hormone replacement, and should I start taking estrogen either as an estrogen cream or estrogen tablets and all that, because my body is not producing estrogen, and I still want my hair to look bouncy. I don't want my hair to become thinner, bald here. I want my skin to look all squeezy and nice, and I don't want it to sag. see, first of all, hormones, like I said, they are powerful. Estrogen as a hormone comes with some terrible side effects. And ethically speaking, there are women on hormone replacement therapy, but they're usually given when their, the bones are showing massive degradation, or when they're having very terrible mood swings or hot flashes. We do not give hormone replacement therapy solely as a beauty treatment. Secondly, yes, this is a time where you have to maintain what you have been doing through your 40s, through periodic Botox and fillers and skin tightening lasers. Dryness is a main problem after menopause. Everything dries up, your face, your body, your private parts. So, the regular, people say that I've been taking hyaluronic acid creams and serums and doesn't seem to be working anymore. So you can think of skin booster fillers where hyaluronic acid is directly injected into the skin. It's not necessary you need to start it in your 50s only. You can do it even before. So that gives a little more longer lasting suppleness to your skin. But yes, these are the rapid decline years. But if you start investing in your skin from your 20s itself, you will start reaping the benefits later on. So for some people who are asking for queries on blackhead removal and things like that, we did speak on exfoliation. I think 30 minutes before we covered that. And like I said, recording of this video will be posted at the end. You can go through it again. And almost most queries have been answered. The main topic is anti-aging. We have not covered a lot on pigmentation, but I have spoken on sunscreens and vitamin C and beta carotene. So it will cover some of your queries on pigmentation as well. So finally, to wrap up, again, why is aging even important? That's again, some people will then, speaking philosophically, do we even need to do anything at all? Isn't it normal? Isn't it natural? Won't we all go old? Do we even need to do anything at all? I would just like to age gracefully. Now, see, even people who say that, I don't care, I'm not going to do anything, but even they would say, we just want to age gracefully. So what do you mean by that? You want to age gracefully? I think what most people say by that is that it's not that they are not afraid of growing old. Everybody is afraid of the idea of growing old. Even people who say that we don't care and we don't do anything and we're just natural and we're natural beauties and all that, even they will feel a little bit of a panic or a shock when they see their first gray hair, or when they see signs of decay in their teeth, or when they see signs of wrinkles, or when someone points it out to them, oh, you're looking older now, no? But what they mean by aging gracefully is that I know I'll grow old, but wouldn't it be nice if I look young for my age? It's not like, when I'm 40s, I'm trying to compete with 20-year-olds, or I'm trying to look ridiculous like that. But for a 40-year-old, if people think, if they were to guess my age was 35, wouldn't it be nice if I could look young for my age? And why that also? Why are people so afraid of growing old? I think preservation is also, the most important of human instincts is survival. And survival comes with preservation. We like to preserve things. We like to hang on to things. We like to preserve our health. We like to preserve our bodies, our figures. We like to preserve our homes in a beautiful state for as long as we want, even though our house is also getting old. So I think that's just a natural instinct to preserve and to hang on to things the way it was. So, and to restore what time has taken away from us. If time has taken away some beauty, if time has taken away the darkness of our hair. So we would like, sorry about that. So we would like to, preserve, we would like to restore that a little bit. So it is only natural instinct. Second thing is, I think people still connect youthfulness with good health. If someone looks young for their age, we assume, they may be having mental health issues, they could be having a thyroid problem, some blood pressure issues or something. But if someone looks young, they look fresh, they look strong, they look vital. We assume that they're healthy. We assume that they're happy. They must be happy. That's why it shows, they look young. So, and, they attract good energy. They attract good vibes from others as well because of what they are projecting. So like they said, there's a famous saying that age wrinkles the body, but quitting wrinkles the soul. So we want to be relevant. We don't want to feel left out. And the older we get, we feel like we're getting left out, we're getting irrelevant. And that's why I think people look for anti-aging solutions, to feel that we are still in the know, to feel that we are still relevant. So this is just, one topic that we're speaking about today. And I know that usually people, when a doctor comes online, through one of these 7-minute programs, they go beyond topic as well. There will be a lot of queries. People want to know about, food ingredients. There are queries people have asked about pigmentation. There are some people who have asked about open pores. Someone has asked about sunscreen. Someone has asked about skincare for oily skin. For all the queries that I've not been able to address only through one podcast, you can go to my Facebook page. It's Your Family Dermatologist. That page has been active since January 2014. So it's 8 years now. And if you go through those pages, all the posts that we have made over the years, you will find a lot of information for almost every query I've had over the years. From skincare, from all the common skin problems we see, from dandruff to fungal infection to nail problems to shampoos to hair colors and all of that. So you can go to my Facebook page, Your Family Dermatologist, and you'll get a lot of information there as well. So I'll once again go through if there's any queries that we have had. Let's see. I think we are pretty much wrapping up the program. Okay, so if there are any more queries or questions that you had, and so basically, if you are hearing a lot about these little things, like retinol, for instance, I mean, usually I would not recommend retinols. Final word on skincare for men. There's not a huge difference, but yes, and basically men have thicker skin, so men can generally handle retinol, for instance, better than women. And men are generally out in the sun more. We also take history if you're a smoker and things like that. Cleansing, moisturizing sunscreen is same for men as well. We would add retinol for men from the 30s itself. And not a lot of Indian skin can handle retinol very well, so use it carefully. Whether it's a retinol or retinoic acid or retinaldehyde, leave the choice to your doctors. Start with using it maybe 2 days in a week, once in 3 days or 4 days, then gradually build up to alternate night basis. And if you have oily skin, you will eventually be able to use it every night. For those who cannot tolerate retinol, you can consider bok choy oil, and that's less irritant on the skin. Niacinamide is not so much of an anti-aging ingredient. A lot of people are asking me about niacinamide. It's mostly for people with oily skin and acne. It can help in controlling sebum production. It can help in keeping acne and acne marks under control. A little bit of redness and inflammation control as well. Less effective for pigmentation. Not really known as an anti-aging ingredient. And I guess we have covered almost all queries for today. Okay. So we have 10 more minutes left, and I am trying to see if there's anything that I haven't covered from our side. And okay. Alright, are there any more questions? Basic precautions for sun-exposed skin. Okay, basic precautions for sun-exposed skin, we have covered this. Sunscreen is the main precaution, and the other thing is eye protection as well. Eye protection in the form of using a good quality sunglasses, a Ray-Ban or a Polaroid, something that actually has UV filters. And if you're going to be out in the strong sun for a little longer period of time, like a beach or something like that, I would say even use a hat. Try to stay in the shade. If it's possible, try to cover up. Using a very see-through kind of a flimsy beachwear or something like that doesn't really protect. Usually, denim kind of material or khaki material, that is a little more, because it has a tighter weave, that will protect you a little more against the sun. So that's for sun protection. And beta carotene, for those who are out in the sun a lot and they can't help it, athletes and field work and everything, in summers you can also take beta carotene as an oral supplement to protect you. All right. And thank you. I mean, someone has said very informative session. Like I said, anyone who joined in late, we covered skincare in 20s and 30s a while ago. A recording of this, we will post it at the end. You can go through this whole video once again for those who are not able to join earlier in. I'm just going through the questions again. Okay. Blackhead removal scrubs. Actually, like I just covered one before, physical scrubs don't really work very well. Salicylic acid face washes, you can use those charcoal based blackhead removal strips if it's on the nose. Again, don't overdo it. Once in 15 or 20 days is more than enough. Chemical exfoliation, salicylic acid containing serums or retinol if you're able to tolerate it, or tretinoic acid, tretinoin creams. That is doctor recommended, that you have to get it by prescription if your doctor feels that you can tolerate it. This can help in reducing blackhead formation, but blackheads can be stubborn, and skincare you'll have to continue with it. Okay. So there are certain procedural interventions as well, chemical peels and hydrofacials that can help in sucking out those blackheads, comedone extraction done at the doctor's office. So open pores, someone had asked about it before. Open pores, first of all, this is again, I would say there are few reasons why open pores happen. One is they're a little more common in people with oily skin. They are dilated openings of the oil glands. Second thing is open pores is also part of aging itself, because your skin is losing its elasticity. The collagen is coming down, and because of the loss of elasticity is why your pores are opening up like that. And so this is why it is important to start your skincare in your 20s itself, so that the pores don't show up. So when you see your dermatologist and ask them how come you don't have any pores, it's because we've been taking care of our skin for a long period of time. But once those pores develop, there is really no cream or toner or scrub that can really get rid of open pores. Open pores will require lasers to tighten it up. But again, with lasers, perfection is not possible. Lasers will tighten your pores to a great extent, but you will require maintenance sessions, every 3 or 4 months to maintain the results, along with the right skincare to prevent the pores from widening up again. All right. So I think that wraps up the program pretty much. Thank you all for joining in. I hope you found it informative, and I hope for those who are still in their 20s, you will start taking care of your skin right now and invest in the right skincare. After all, when people meet you for the first time, it's your face that you project first, and first impressions are important. So invest in your skin, use the right skincare, do the basics only, but instead of buying 10 different products and everything the wrong kind, or looking for the cheapest available one, go to a dermatologist once at least to get an idea of what works for your skin. And once you do that, once you figure out what works for you, stick with the program. Periodically, every 3-4 years, go back to them, make sure that what you're using is still relevant, and especially if you've had acne, please address it. Don't just think that acne is a rite of passage. Everybody in their 20s, every other person has acne. It will come, it will anyway go away. If you don't take care of it now, it's going to leave a lot of damage, a lot of open pores and marks and scars. In your 30s, you look older compared to, say, your older sister who never had acne, and she now looks younger than you because she didn't have acne, and your acne has left your skin looking older before time. So, and please understand that whether it is acne or whether it is anti-aging, consistency is key. Don't go to a doctor with acne thinking that one prescription is going to cure your acne forever. Acne is a chronic condition. Usually people have acne for 5 to 10 years, starting from age 15 to age 25 on an average, before they outgrow it. But there are plenty of people who will have acne well into their 30s. So consistency is key. Don't keep switching doctors. Don't keep changing things, hoping that somebody will give you a permanent solution. It is only natural for people to look for permanent solutions for their acne, for their gray hair, for their dandruff, for their aging. There is no such thing. Whatever you do, whether it's your mental health, whether it's your physical health, whether it's your fitness or keeping your weight in control, similarly for beauty and aging as well, whatever you do, it is a lifetime commitment, and you have to stay consistent to it if you want it to work. All right. So with that, I will be signing out. Dr. Sunaina Hameed, thank you for joining in. Bye-bye.